This week in your health policy course, you're going to be studying the adoption and the implementation phases of policy. Many years ago, a very dear friend of mine told me that I needed to quit worrying so much about the technical facts and start learning to tell a good story. That I was letting all the facts get in the way of my ability to write in a convincing manner. Now, at the time, of course, that made me crazy because all I cared about were the facts and the truth. But sometimes all the technicalities don't do anything to convince people. Years later, when I was presenting at a conference, a state representative from New York came up to me afterwards and he said, all the facts in the world aren't going to help me sell this to my constituents. You have to come up with good examples, real life stories that I can tell to the people that vote for me. And I think it then finally sunk in. Along the way, I had learned to write good stories and to tell convincing stories in person, but I was still really concerned about all the technicalities and all the facts. So when I'm presenting to a professional audience, my presentations would be laced with those. And while I would tell the story, sometimes I was still losing people in all the facts. So this week, when you're exploring the adoption of policy, know that as the person that's writing the policy, as the policy analysis, working for a representative or working for a cabinet secretary or whoever else you happen to be working for, even working for the CEO of your hospital, the policy you write, that person has to be able to get the buy-in of all the people responsible for actually voting on that policy. So learn to tell the good story. And then the second thing is that once it's passed and you have gotten to the point that it is ready to be implemented. So you told your good story and your representatives are now going to implement it. You need to know that every once in a while, what Congress, for example, passed and what Health and Human Services may have written as the rules and the regulations about how it was going to be implemented don't always match up. One day I was in a meeting when I was working with the National Commission for Children in Disasters, and Chris Dodd came to our meeting to discuss the policy we were proposing. And he explained to us how they had already passed legislation that did what we were asking him now to do. And we explained what was wrong with that regulation. What was wrong with the law, and how based on the way it was written, we couldn't possibly implement that. And he just looked at me and he shook his head and he said, how did anybody ever get that interpretation out of what we wrote? That was not the intent. Every once in a while, there is a chasm between the people that write the law and the people in the government agencies that are responsible for implementing it. And those of us who are responsible for implementing it sometimes are so wound up in the facts and the technicalities that we forget the intent. You need to remember that getting something adopted is only half of the job. The other half of the job is getting it implemented in the way that it was intended. Now, this is important for not only people in policy, but this is important for researchers. So, for all of those nurse researchers out there that are doing their PhD and they want to be a bench scientist, or they want to do research about new practices in healthcare that's going to make people recover quicker and life better, and or them have fewer symptoms or increase patient safety, here's what you need to know. Your research is a wonderful thing. It can make big changes. But if all you ever do is the research, and as soon as you're finished with it, you have created the best thing since sliced bread, and you say, well, I did my research, I got my grant funded, I did my research, I wrote my paper, and it was published, I'm done. That means you're leaving it to somebody else to make sure what you intended is actually implemented. And if you don't push to that next step, there's a good chance that your research is going to stay in that journal, and other well-meaning students are going to cite your research, but it's never going to improve the life of a patient because you didn't make sure that it got implemented into policy and into practice. So this week, when you're doing your assignments and you're reading your textbook, imagine how you're going to bridge adoption to implementation, and think about the pitfalls in the way. And those are communication and understanding.